Hello, my name is Dr. Lindsay Brandwood. I am a GP and I work with Glossop Primary Care Network in the Team Up team. This is a quick but really important message about bowel screening. In our area, we have a slightly higher risk of bowel cancer on average compared to Derbyshire and the rest of the UK, but we also have a slightly lower return rate on our bowel screening tests. This is a message specifically for people in Gamesley and Glossop. It's a way that we can help you understand what you need to do for the test, dispel some of those concerns and help you get those tests returned. So the first and most obvious question is, what is bowel screening? Well, it's a test that's sent by the NHS Cancer Screening Programme, and it's a test that looks for tiny microscopic bits of blood in your poo that you wouldn't be able to see just by looking at the poo itself. The test is completely free. It's sent to you in the post, and you should receive one if you're aged between the ages of 50 and 74, and you will get one resent to you every 2 years, and it's important that you do the test and return it each time it's sent out to you. So this test is a simple way to pick up early signs of bowel problems. The thing with bowel cancer is in the very early stages, often there are no signs that you can actually see, you have no symptoms and you feel completely well. So the test can pick things up at that very early stage, hopefully even before there are any changes associated with cancer, just those early changes that need to be monitored, or it can pick a cancer up much earlier than it would otherwise have been treated. And the major benefits to this are that you can have much more effective treatment, and what we're aiming for is for people to have treatment that leads to cure. Now, we know that when we're asking people to do a bowel cancer screening test, the idea of finding a cancer can be really anxiety provoking. So it's useful to think about the context, the bigger picture. So with the screening test, for every 1,000 people that do this test, only 18 of those will have an abnormal result. The rest of those 1,000 people will have a normal result and will be reassured that there is nothing to worry about. Of those 18 people with a positive test, only one of those 18 will go on to be diagnosed with having a bowel cancer. Another one person will be found to have a condition that needs monitoring, so maybe a polyp that has a high risk of becoming a cancer in the future. And the rest of those 18 will have something else that isn't anything to do with cancer. So they might have piles, or they might have a bit of inflammation in the bowel caused by something else, but no cancer. So they can then be reassured. So the other thing that can be a barrier for people is that we are talking about poo, and that can be embarrassing. People can feel a bit uncomfortable about it. They might feel a bit gross about it. And that's understandable. It's not uncommon. We need to understand what the test is, how we do it, and that should hopefully make you feel a bit easier about doing it. What you'll expect to receive in the post is a tube that looks something like this, and this will have your information on it because it's sent out to you. You will receive an instruction leaflet that will talk you through step by step, and it's got pictures to show you what to do. So you may have a double-sided one like that, and you will receive a bag for you to put your test in once you've done it. And then you will receive an envelope, and you'll be able to pop all that in the envelope, and that will be addressed to where it needs to go, and you can free post it back. So the next step is actually getting your sample, which isn't as hard as you might think. All you need to do is get yourself a container. So an old takeaway container works quite well. Any container that you've got that you don't mind using, make sure it's clean and washed. You're going to get a little bit of paper, pop it in the bottom. So you've got that, and then you're just going to pop that inside the toilet, and then you can do your poo as you would do normally. The most important thing about this test is not to get the poo into the toilet water. So if the poo misses your container somehow and ends up in the toilet, abandon and then do it with the next one. So we're going to pretend we've got our sample, and I've got a handy banana. You're going to get your sample swab, and you're going to take the top off like this, and then you're going to use this to just scrape along the top of the poo. That's all you have to do. You can dip it in and just scrape it like that, and that's it. You don't need loads of poo. You don't need to touch the poo. Your hands don't need to go anywhere next to the poo. You just keep hold of this, scrape it, and then you put this inside, and that's it. Sample's done. So all that's left to do now is to take your completed sample, pop it in your prepaid envelope, and send it back to the screening service. and they'll do all of the things they need to do, and they'll be in contact with you with your result in due course. I would recommend just forgetting all about it until you hear back from them. If you make a mistake, if you feel you've not done the test properly, if you lose the test, if you decided you didn't want to do it last time and now you've seen this video, you're happy to do one, all you have to do is contact the screening program and they will send you out a new test. Don't worry, it happens all the time. Don't be embarrassed. People forget things, people do things wrong. We're all human, it's not a problem. We would absolutely prefer you to request another test than not. So if you do need to contact the bowel cancer screening program to request a new test, then you can call them or you can email them and we'll put that information on the bottom of the screen for you. So this is the final message from me, and it's just a real plea. You know, this test really does save lives. It's very quick, it's very simple. Take a few minutes to do it and return it. And from Team Up and the rest of Glossop PCN, we wish you all good health. Thank you.